It's the sheer breadth of knowledge that you're forced to use every day. And it's not just general practice management, it's acute care, it's chronic disease management, it's knowing about social histories and working out, social issues with patients. It's understanding family dynamics and understanding women's health, understanding kids' health. So you're exposed to a huge amount of different cases every day.
The good thing about this sort of medicine is the fact that you will see everything, You tend to be better at managing these diseases by yourself, which makes you probably a better person, even if you weren't going to stay out in the country, to go back to the city and take those skills back with you.
It allows registrars to be exposed more to the family and social impacts on health, but also allowing them to treat a patient, factoring that into considerations.
We're able to give the GP registrars a little bit of a window into what is possible within the Indigenous health industry. It also exposes them to a really broad cultural understanding of people's needs and how the family and the patient and the GP registrar or allied health person or whoever it might be concerned within their care all come together as one unit.
When you see GPs, not from an Aboriginal or Torres Strait Islander background, working now within an Aboriginal and Torres Strait Islander community-controlled health service, you see the benefits. Within a mainstream GP service, you don't get that. The opportunity isn't there for, the doctors to be really fully involved with the patient care.
I enjoy looking after you all right then. That's good. Can I have a quick listen to you now? I think because I enjoy getting to know people a little bit more than just the 5-minute consult that you have, and I'm genuinely interested in people's families and where you come from and how your dynamics kind of work, that it's sort of a good fit for me, Indigenous health, because it's all about family and where you come from and where your people are, and knowing where you sit in the community with regards to that.
Deadly.
Too deadly, Uncle Gary.
I think the perceptions that they show you in medical school is that, you got people with sort of third world sort of conditions, but in reality, most of it is just chronic conditions, a bit the same as the rest of the population. It just tends to be usually more severe and advanced. But once you realise that you do have all the skills and you've been learning them all the way up till then, and you're quite capable of doing it yourself.
A GP registrar that's here and part of this service gets to be part of literally history-making cycles of care, history-making methods. They're able to take part in the change that's happening. They're able to look back on their time here with us and, with some degree of pride and actually see what difference they've made. Down the track there might be things that come out later on in health, in medical journals, or what's talked about on the news. They can say, I was part of that. I was there at the beginning. I saw it and helped it develop.
Our model of care is based around a multidisciplinary team. So we see the GP registrar as a key part of that team, so that when we're providing care to our community who come into our service, that the GP registrar is part of that, and we're ensuring that that they're up to speed and certainly supported in all areas, including the cultural aspect.
The GP registrar, when they come on board with us, is looked after by a cultural mentor, as well as the other staff that are able to answer questions and guide them all the way through.
And also around the social structure within that community, focusing on the cultural aspect side of it.
Since I've been here, I've been able to start a Mums and Bubs clinic. So we run a Mums and Bubs clinic every Tuesday here, and it's really helped boost the services, access for women and their kids to come in, have regular checkups. We've started doing antenatal care, where previously we've had very little in the way of antenatal patients coming to see us at the service at all. We've got mums bringing their brand new babies for their 7-day checkups, and they're coming back for their immunisations.
You sort of develop some good relationships with some of the Aboriginal peoples, and you know, some of them even almost give you a hug at the end of it, and that's quite rewarding. You know, you become their friends, and you don't sort of get that, I guess, that art form that medicine's lost a bit in the city, that depersonalisation that tends to be still out here in the bush.
And that's where kind of this whole sort of social and community type knowledge of where that person's coming from is so important. Trying to be able to figure out ways around things and really engage with your patient to try and get the most for them and the most out of your time with them. And sometimes, yeah, you do end up doing everything because you can't send them to specialists, so you have to sort things out for them.
It's a great opportunity for advancement and also for self-experience for any of our GPs or registrars within our organisations, and just really understanding the care of our Aboriginal and Torres Strait Islander people, and taking into account that it's different when you're in a mainstream service, that within our service we tend to take more time to allow, you know, ourselves to really identify what the health issues are within our people.
Aboriginal health and medicine can be something that everyone, I think, should have a go at, you know, and some people will find that that's their calling, but I think unless you go out there and give it a go.
As a 12-month period, you can actually see a dramatic improvement in that person's life and have known that you've actually made a difference in their lifespan. This sort of Indigenous health model, this is the one that actually makes the difference. But this is the cutting edge of that medical change. This is where community medicine and health needs to go. And within a centre like this is the way. This is the forefront of community medicine.